Hello, I'm Tate Yoder. I'm the creator of StarWrap. You're looking for a spot that feels tender but feels good to apply pressure. The StarWrap is based on direct pressure applied to muscles in the body. This method provides the same effects as massage therapy and self-myofascial release. We understand the said principle of specific adaptation to imposed demand. The body adapts to whatever you place upon it. By wearing the StarWrap, we give our bodies the two most important factors related to tissue deformation, namely force and consistency. The force is applied using the uniquely shaped star activators, and the neoprene wrap enables that pressure to be maintained on the body. We will discuss how long is appropriate to wear the StarWrap. A good rule of thumb is the healthier the tissue, the faster the tissue responds to the imposed demand. Conversely, the tighter, more bundled and less oxygenated the muscle tissue, the slower the response time. Start with the general activator in place on the inside of the StarWrap. Tighten to your tolerance. You should remain relaxed as you begin movement. If the pressure is too much, you will tighten up. The intensity should not increase. If it begins to become painful, remove the StarWrap and find a less intense site. Many times we target areas too close to the site of pain. To avoid causing harm, begin away from the site of pain and find muscles that relate and are involved with the symptoms. Activation movements are simply to move the muscles that you've targeted using the StarWrap. Any movement works. We recommend simply moving in different ways than you are accustomed to in order that you break repetitive movement patterns in your muscles. We have found moving in small circles starting at the base of the foot and moving to your ankle and knee and hip and slowly connecting through circular movements the joints in your body. That's the best method for unwinding tissue tension. And if you find restrictions in that joint, you begin with micro movements to really isolate fibers that are causing some of those restrictions. Wear the StarWrap as long as you feel it is not causing pain and providing a positive stimulation to muscle fibers. The average length of time that an individual will wear the StarWrap will vary based on the individual's level of tissue health. Some find 2 minutes plenty of time under tension, while others can adapt and wear the StarWrap for much longer periods. Overusing the StarWrap can cause bruising and lack of circulation. If pain increases or you notice tingling in your extremities, remove from the targeted area. Notice Delilah is attaching the extension strap to the StarWrap for additional length. Now the StarWrap can be worn on the quadriceps and hamstrings. The palpation exercises are the same throughout the body. We are looking to find tender muscles that are tight and bundle. Begin at the musculotendinous junction as the concentration of muscle fibers is the highest. To find the musculotendinous junction, take 3 finger width length from where the muscle attaches around the joint, on the bone of the joint, and at that place, 3 finger width length down from that attachment site is the musculotendinous junction. Targeting this area is based on research and work called neuromuscular therapy and spinal reflex therapy that teaches targeted, specific, direct pressure near muscle origins and insertions have the greatest effect on tissue responsiveness. But remember, if the area around the joints are inflamed, do not wear the StarWrap on those areas. If there's pain upon placement, find a different location along the muscle length to begin the protocol. Palpate the tissue to find tight, bundled muscles. Target a muscle at the musculotendinous junction, at the muscle's origin or insertion. Apply the StarWrap by adjusting the pressure to your desired intensity and begin muscle activation movements. Begin some gentle squat exercises, making sure you draw in the navel, sit back keeping your knees above your ankles at a 90 degree, and that there is no pain in the knee or hip joint. Walking will also challenge the tissue and is sufficient movement to cause the recovery response. For proper StarWrap application, we're going to use 3 finger widths from the site of the muscle attachment around the joint. So place your fingers on the joint, 3 fingers length, and at that place is where we can start StarWrap application, which is the musculotendinous junction. Begin movement activation of hamstrings by performing bodyweight deadlifts. Keep the navel drawn in and spine in neutral, bending at the waist. Progress with the single leg deadlift, making sure to keep your hips flat, a slight bend in the standing leg, and bend forward using the glutes and hamstrings. Keep your spine neutral and bend only as far as comfortable while maintaining control of the movement. All micro movements and circles going in both directions. Palpate the front of the hip and the glute medius to locate any tension around the femur head. This is a high concentrated area of stress, and releasing the tissue can prove extremely beneficial to knee, hip, and lower back conditions. We have found that the areas around the head of the femur have a high concentration of muscle attachments, and targeting the musculotendinous junction has proven effective at releasing deep gluteal tension. As with all StarWrap applications, begin slowly, letting your body absorb and relax around the chosen activator. Start with less pressure so your body can remain relaxed. You are targeting muscle fibers that require small, micro movements. We recommend small circles in both directions of the targeted joint. Support your weight in a side plank position to apply the right amount of pressure. You may also find pillows and bolsters to help ease your body into the right amount of pressure. Insert the specific activator into the mesh foam roller. We are now targeting the tensor fascia lata above the femur head. Begin the protocol by palpating the area, find a good spot of tension, slowly lower your body weight into a comfortable position and begin muscle activation. Moving on to the lower back and obliques. We are palpating above the iliac crest into the internal and external obliques as well as the quadratus lumborum muscles. Start with the general activator and key in on the gap between your hip bone and your rib cage. This is a very sensitive area, so move slowly and readjust as needed to find a comfortable position. The hips directly relate to tension in the lower back. The quadratus lumborum muscle is a major muscle involved with lower back pain. It is found deep in the lower back. To access and be able to apply direct pressure, the internal and external obliques must first be released. The muscles around an injured or tight area require ample time under tension in order to release. We have found gentle, consistent pressure that targets the most responsive tissue provides the greatest relief. If appropriate, progress to the linear activator to target the same area of the lower back. This is, again, a very sensitive area, so take your time. Allow the tissue to relax around this specific pressure. Breathe and be as gentle as possible. Less is more when it comes to allowing tissue to relax under direct pressure. This progression can be made more gentle by laying down on a softer surface, by supporting your body weight with bolsters, or by using the stack method, combining the general and linear activator. Discontinue if pain increases and find a different area to target. This becomes a therapeutic experience when you can relax around the stimulus, breathe, visualize blood flow entering into the muscle tissue, and moving with small micro movements. Due to our postures working at computers, the shoulders have a large amount of tension in and around the humeral head and around the shoulder joint. Finding the adhesions in this area is not difficult. We recommend starting near the thoracic spine and moving out laterally towards the shoulder blade and the shoulder head. Moving on to the upper shoulders and mid-back regions, start by feeling for tension in the upper trapezius. Use the different activators as palpation tools to determine areas of greatest tension. Start again with the general activator to target the area of the upper back. Let your body slowly adapt to the pressure. Begin muscle activation exercises by moving the targeted muscle. Small head flexion and extension movements are sufficient to challenge the tissue. Postural muscles of the upper back require ample time under tension due to the nature of the work they perform on a daily basis. Helping your clients understand that we are talking hours and not minutes of stimulus in order to feel the tissue relax is important. Stay in tune to how your body is responding and continue to focus on the process of targeting responsive areas, allowing the tissue to respond, letting go more deeply, and breathing through the discomfort. Progress to the linear activator and continue using the appropriate force of pressure combined with muscle activation as you feel for tissue to release and the intensity to diminish. Times will vary between individuals. When you notice some restriction in joint mobility, slow down your movement and begin small micro movements. Use a specific activator to apply targeted direct pressure to the rotator cuff and posterior shoulder musculature. Begin muscle activation movements with the arm. The goal is to find restrictions in joint mobility and explore muscle tension that causes limitations in range of motion. Dalila is performing internal and external rotation of the humerus, as well as protraction and retraction of the scapula. Other possible movements are elevation and depression of the scapula and circular movements that explore the 360 degrees of range of motion in the shoulder joint. Slow down your movements and feel for any restrictions, and then target the muscles around those restrictions and begin micro movements. Begin palpation in the chest and pectoralis muscles. The specific activator is best for targeting smaller muscles, although the general may be more gentle to begin as this area is normally quite sensitive. Dalila begins by targeting the subclavius, or muscle just below the clavicle. This is a high attachment area of both chest and neck muscles, and it is also the location of the musculotendinous junction for the pectorals. This area is very sensitive and can produce tremendous results for neck and shoulder pain. Be extremely gentle and begin using the general activator. Dalila is also targeting the pectoralis major and minor muscles near the shoulder. Muscle activation movements while holding pressure serves both to assess the area for specific adhesions and trigger points, and also can release tissue tension. Dalila performs small movements of the shoulder and arm to activate the pectoralis muscles. Begin with small circular movements and find a position that elicits some tenderness. Start targeting the pectoralis muscles using the general activator. Again, gently relax and lean into the pressure slowly. Adjust your position as needed to find any muscles related to tightness in the shoulder and pec. The objective is to target as precisely as possible the specific muscle fibers related to restrictions in your joint mobility. Movement activation is a fluid exploration of that tissue tension and determining how to position the joint for the best release. Notice Dalila reposition herself as the tissue begins to respond in order to best target and stimulate the pectoralis muscles. This is a normal protocol to readjust and reposition for optimum targeted specific direct pressure. This method is tuning the practitioner into their body's deep muscle fibers. Sensitivity to pressure and controlled movements are essential for appropriate force on targeted musculature. Be gentle, move slowly, breathe, and tune into your body. Combine the general and either specific or linear activator to create the stack. This method provides 4 inches of targeted specific direct pressure. It creates a versatile, easy to use travel option that can be used if the intensity of the foam roller is too much. The process is the same for palpating, targeting, and activating muscle tissue. Try this method on the hips, lower and upper back, and into the shoulder musculature. Dalila is demonstrating the various applications and areas that can be targeted using the stack method. What's most important to note is choosing the best star activator for each area. Dalila is using the linear activator for the top of the glutes or the glute medius. The linear activator is placed along the ridge of the ilium. Note how Dalila gently rolls her body weight onto the activator, adjusting as necessary to provide the appropriate force to which she can relax. By simply turning her hips towards the activator, she can adjust the pressure as needed. The linear activator is also good for targeting the quadratus lumborum just above the ilium and below the ribs. Dalila is placing the activator across the obliques parallel with the ilium. The site she is targeting is slightly posterior, but not directly towards the spine. The specific activator is used to target the smaller muscles of the rotator cuff. These muscles connect from the scapula to the humeral head. This area is normally overused from computer work and many lifting and holding postural positions. It's an extremely important area to target for any shoulder pain. Like always, begin by gently lowering your shoulder onto the specific activator. These muscles are smaller and will roll around, so find one to target and try to pin it down. Begin the process of targeting muscles of the forearm and upper arm. Avoid areas of inflammation and the front of the elbow and wrist. We recommend using the general activator to palpate if there is any pain in the wrist or elbow. If there's a lack of blood supply down the arm, wearing the StarWrap can negatively affect blood supply. If tingling or circulation is impacted, remove and work on helping improve circulation in the arm by focusing on the shoulder and upper back muscles. Specifically target the muscles along the thoracic spine where the nerve path begins. Notice Dalila is targeting the musculotendinous junctions of the wrist and elbow. These areas can be sensitive if suffering from carpal tunnel, tennis, and golfer's elbow. It's important to understand that the StarWrap provides the body with direct pressure on specific muscle fibers. Wearing the StarWrap provides substantial stimulus that research indicates is one of the most important factors influencing tissue transformation. We recommend using the StarWrap during warm-up and cool-down phases of exercise. We also recommend wearing the StarWrap throughout the day. We consider this modality a positive stimulus that the body can easily respond and adapt. We have found this system provides blood flow to specific areas of the body. Determining where to place the activators is best instructed by a health professional. Due to the precision of the Star activators, finding the right muscle to target is important. The length of time worn varies between individuals, but research indicates that the consistency of appropriate force is the most important factor in tissue transformation, or in the case of StarWrap applications, getting muscles to relax. Our goal is to help users understand if the tissue is stimulated more often with blood flow, it has a better chance of tissue tension being reduced. Increased blood flow has dramatic health benefits to all of the systems of the body. Just as the health benefits of exercise are numerous, the effects of muscle tissue health on joints, the spine, and the nervous system, injury prevention, and athletic performance can't be overstated. We believe soft tissue health and teaching how to achieve it is vitally important for improving the health of our clients and customers. Applying targeted, specific direct pressure combined with movement exercises provides a system of unwinding deep tissue tension and breaking repetitive patterns. Practice active recovery as often as possible. Explore how healthy you can get your tissue. We recommend not only targeting areas that are problematic, but also on healthy tissue. Some important contraindications to think about are avoiding all endangerment sites. So that would be the front of the elbow, under the armpit, behind the knee, on the carotid artery. Avoiding any nerve endings or nerve pathways. Avoiding the tendons and ligaments within the joint. So what we're trying to target is the musculotendinous junctions where there's the highest concentration of muscle fibers. So those are the areas we'll want to target, and staying off of any area that the pain increases or you notice a irritation to your nervous system. Your professional expertise is invaluable to teaching the public the best methods of application. Once clients learn this process, they become empowered to release areas of tension in their bodies and reap the benefits of healthier tissue. StarWrap will help clients in two ways. Number one, it helps warm up tissue before applying kinesio tape. Secondly, it informs clients of exactly where they carry their tension and which muscles are most related to soft tissue conditions. The combined treatment protocol provides a positive and negative stimulus to the body. This new approach has proven successful with our ongoing current studies. We welcome your feedback and challenge you to find clients dealing with soft tissue conditions and start star wrapping. Thank you so much for your time, and thanks to Kinesio Tape for helping us introduce this new modality to you.